Thanks everyone for being here. It's 4 now, so I think we're gonna get started. And there's a bunch of swag that we brought in on the back table, and please take some so that I don't have to take it back with me.
Okay. 皆さんこんにちは。私キム・サヤンと申します。私NACDA のディレクトでミシガン大学の教授ずっと務めております。Good afternoon. I'm Sayan Kim. I'm a director of NACDA, and I'm an associate professor of University of Michigan. And we are going to talk a little bit about the NACDA resources for gerontological research, not specific for gerontology, but gerontological research, mostly training and education. So let us do a little bit of a survey. How many of you have heard of NACDA? No, that's good. This is good. We have a new audience. How many of you are using secondary data sets? Secondary data sets meaning like longitudinal. You didn't collect the data. Great. Awesome. How many of you are PhD students, master's students? Okay, great. Awesome. That helps us contextualize a little bit. So we're going to talk a little bit about that. My name is Sayan Kim. This is Catherine Lavender. We're going to talk a little bit more about the context, right? Why do we need longitudinal data? And what is the context of gerontological research? And we're going to introduce NACDA, and then Catherine will take over and talk about the search, like general searches and functionality of NACDA site to identify some of the possible data sets and metadata, and then data citation. And then I'm going to talk a little bit about the NACDA in the context of sort of some of these technological changes and advancements. So in the US, 1 in every 4 people are 65 and older, and it's similar to the population of Washington, D.C. And baby boomers, more importantly, are more educated and healthier than the preceding cohorts. So it's actually important to think about this compression of morbidity or extending the healthy lifespan, right? You have the lifespan, but then you have the healthy lifespan, health span, where you spend your life being independent and without any major sort of conditions. And active and healthy older adults lessen economic burden, which is currently about $435 billion a year in the US. And in Japan, which is the world's oldest population, it's 1 in 3 individuals, population aged 65 and older. So about 9.3 million older workers represent about 1 in 7 workers. And Social Security costs have risen to about 10% of the Japan's GDP. So in this context, right, studying aging and what makes us healthier, what makes us sicker over the life courses is important. So that is why we think about the longitudinal data, right? So aging is a process. No one is born 65. No one is born 70. So it is a process, and it's never linear. A lot of the aging processes are not linear. So following cohorts over time offers a lot of insights into some of the individual variabilities, because not everyone ages in the same way. So a lot of the developmental psychologists will study adolescents or infants. They sort of age, or they develop in a similar sort of way. We have like normal development trajectories. As people get older, that variability is widened. There's an incredible heterogeneity within the older adults population, so we can study that. Prediction of early life risk factors that could impact later life outcomes, and then the interventions. When can we intervene? So if obesity predicts some sort of the adverse health outcomes, and when can we intervene and sort of break that cycle? So that's why we use longitudinal data. But in terms of the secondary data, right, we can collect our own data that's called primary data sets. But primary longitudinal data pose very important challenges. Mainly, it takes a very long time. It takes 30 years, or it takes 20 years, or 5 years to collect longitudinal data sets because the measurement occasions happen more than once. But we can use existing longitudinal data sets because it's efficient. The collection of the primary data, or both qualitative and quantitative, is time consuming. So good secondary data should come in a format and facilitate aging research. And there's variety. So the quantity of secondary data has grown pretty tremendously. So at NACDA, Catherine is going to talk about this, but we host more than 1,600 data sets. And you can use longitudinal data sets to test different theoretical frameworks. So for example, like the socio-emotional selectivity theory by Laura Carstensen, as you get older, you prioritize your emotional well-being and psychological well-being rather than this future time perspective of like career making, right? So how do we test that time passage and that emotional change? So you can actually test theory using longitudinal data. And then importantly, generalizability, right? If you use nationally representative longitudinal data sets like National Social Life Health and Aging Project, or Health and Retirement Study, or MIDAS Midlife in the US, you can actually generalize the findings into the population of interest. So we don't have, in the US, we don't have longitudinal data that follows people from infancy to death, right? So in the second sort of best strategy is something called data harmonization. So this is when you combine multiple data sets that are comparable. Not every single measure is comparable in different data sets, but you can compare, cognition, for example, or personality using one data set that has 20 to 45-year-olds population, and then another data set that has 50 to 100 years old population. So data harmonization is important because, again, aging is a lifelong process, and you can bridge the full lifespan by looking at multiple different data sets and harmonize them, right? So harmonizing data sets is different from just combining two different data sets. It's about finding comparable measures of your interest, and then combining them so that you can compare different populations. And you can also, by doing so, track non-linear trajectories, which a lot of aging trajectories are not linear. There's no linear sort of trajectory. And you can actually disentangle some of the complex influences like the age period cohort effects. So by combining different data sets, you can think about what adolescents look like in 2010 versus 1970, right? So those are very important reasons for data harmonization, and then understanding inequality, right? Why do certain people age more adversely compared to certain people who age more successfully? So an example is NACDA portal. So what is NACDA? NACDA is the National Archive of Computerized Data on Aging. We have existed for more than 45 years, and it's part of the ICPSR. ICPSR is the Inter-University Consortium for Political and Social Research, and it's probably one of the biggest archive of any aging data sets in the world, I think, yes. And it's funded by the National Institute on Aging, so it's federally funded, which is great because you don't have to pay. So all of the data resources are completely free for you. And we host mostly public use, which is important, right? Public use data sets and quantitative data, even though with the technological advances, we have sort of explored possibilities of ingesting qualitative data. although with the caveat of privacy concerns and things like that. But I think we will be able to do that a little bit more. And you will need a researcher passport account to download these data files. But that's it. You just need a researcher passport. And that ICPSR is the bigger organization that NACDA is part of. And it's comprised of different units and projects. So we have NACJD, which is the criminal justice data set. We have the housing data sets. We have the neighborhood data sets, or archives rather. And it's funded by a variety of resources. So ICPSR is a much bigger organization, and it's, again, mostly public use secondary data. And you can probably find any data set that you might be interested in terms of your social, political, psychological, social work research questions. And data are cleaned, organized, managed, and converted into multiple different formats like SPSS, SAS, and STATA. And it adheres to, we call it the FAIR principle. It's a really, really big word in the data stewardship literature. I just became NACDA director, so less than a year ago, and I found about the FAIR principle about a year ago when I interviewed for this job. And now I cannot stop using it, and it's findable, accessible, interoperable, and reusable. So it's about replicable findings, right? So if I did the research, then someone else should be doing the same research and find the same findings. So that's the reusable aspect. And then the findable is you should be able to find the data sets, and accessibility is you should be able to download and use the data sets. Interoperable is the harmonization aspects. And it's part of the it's part of the Institute for Social Research at the University of Michigan. So why would someone want to use ICPSR data and NACDA data? Because this is real social science data, and it's curated and safe, and mostly consisted of pretty large data sets. So some of the data sets that are used, like NSHAP or MIDAS, have pretty large population representative samples, like for 3,000 for NSHAP, and then how many do you know MIDAS?
I would say it's at least a couple thousand.
Yeah, at least a couple thousand.
Longitudinal, so the initial cohort was maybe a few thousand, but over time it's decreased a little bit.
Yeah, so it's larger. And the data collection, primary data collection, is costly and time consuming, versus if you have the ICPSR researcher passport, you can download them and then start analyzing the data sets, which is really helpful. So you can discover and analyze and publish a lot faster, which is important for your degree acquisition and your career path. So we're trying to help. And we do have helpline, but we also have something called the data-related publications. So if you're interested in, for example, social engagement or personality traits or mortality or, healthcare service access, then you can go to the data-related publications and search for the similar papers that already tested your ideas, right? Or similar to your ideas. And some of the data resources we host related to this, not just the data sets itself, but we also have the documentations like code books and data files and related publications, like we said. And we have some of the self-published projects. So some of the NIA-funded projects will publish their data sets or share their data with us, and then we host the data in perpetuity. And these can include data like syntax or code, which is important for data sharing plan. Increasingly, NIA has, National Institute on Aging has required a lot of researchers to share their data management plan, and then how they're going to share syntax files or codes so that their findings are reproducible. So I'm going to hand it over to Catherine.
Thank you. Thanks everyone for being here. Okay, so We've talked a little bit already about what kinds of materials we host and that you need a researcher passport account in order to download data. And I'm gonna, go through some slides that highlight our website. So when you go to it and you're looking for data, you'll be familiar. So our website is NACDA-aging.org. And if you go there, this is what you'll see, our homepage. And it's a funny thing about the name. Sion said we've been around for more than 45 years, and it's called the National Archive of Computerized Data on Aging. But that tells you that we were around before the data was computerized.
Yeah.
So we specifically had to say, hey, it's digital, But anyway, so you would go to our homepage here, and there's a search right in the middle of the screen. And you can use the search function to type in your search term. I typed in cognition here, and I'll go through what that's going to look like. The search results, the default, it defaults to studies. And a study can be one data set or many data set, but basically a study reflects a data collection by a primary data producer. And so, anybody using these data will be secondary researchers. And so the search for cognition produces several results, more than 300 study results, more than 2,200 data-related publications, and more than 2,000 variables. So those are all facets that you can search by on our site, whether you're searching for cognition or something else, depression, other measures. Maybe you want to type in a couple different terms. If you do that, I recommend using quotes around the terms. It helps the search functionality. But yeah, so say you're searching for cognition and you're like, well, let me click on one of these results. A study page is how you identify which data sets you want to download. So this example is the Midlife in the United States MIDAS 2 Cognitive Project, which occurred between 2004 and 2006. And you'll see all the information about how the data were collected, who collected the data. You'll also see some usage information. This particular study has almost 3,500 downloads. Just we can see from the study page. And then there are 190 data-related publications associated with these data. That means that 190 publications using these data for their research. So basically, I like to say that the study pages are the first step to downloading data, and you should just read through the description and the methodology to understand if it's going to meet your research needs. And you can review the data-related publications to see how did other people use these data. And maybe they're doing something similar to you, or maybe they're doing or maybe you're thinking of doing something completely different. And you would know that because there would be no publications that match your topic. So the study page has several tabs. That first default is the at a glance tab, but there are other tabs like data and documentation, variables, data related publications, and you can even export the study level metadata if you wanted to, like save that study page information. But you can preview variables right in the data set by using the variables tab. You can learn about what other people have published using data related publications tab. And then when you're ready to download, you can either use the download button, which will be on the right-hand side of the study page, to download all of the files in a specific format like SPSS, SAS, Stata, R, or flat ASCII and syntax. So that's why there's that download button there. But then also in the data and documentation tab, if you wanted to download just specific data sets, say there were multiple data sets in the study, that's where you would pick and choose. So the variable search and the variable display is one of my favorite things to talk about, because when you're thinking about your research project and the kind of work you're looking for, the kind of questions you're looking to see did people answer, the variables are going to give you the most insight into that. If I'm looking to see, memory, kind of research. I want to know, did they do like standard memory questions, word recall, counting backwards? Counting backwards is displayed here in these variables. What day is it today? Did the respondent answer the question right? That's where you're going to see, does the data set have that information you need? And again, you can see this right from the study page. You can also search by this from the general search that I showed you before, but it defaults to study, so you have to select the tab. Okay. You can use related publications to find data instead of kind of the way I just showed you where you're looking at the study and then diving into what the variables are. You could work backwards in this way. A search for cognition might show up some kind of article here, like we've got living arrangements and cognitive impairment among Mexican American older adults, nativity differences. And this comes from the Journal of Applied Gerontology. And we can see that this publication is linked to several studies. These are known as the Hispanic EPI studies, Hispanic Established Populations, for the epidemiologic study of the elderly. And so that's a longitudinal data series. And this particular researcher used all of these. And so if you were interested in this, you would look at the results from the data related publications tab and then review them. And you can sort by relevance or recency. You can export those selections to stay organized, and you can export them into like RIS or EndNote. And then you would, if you're reading the article and you're kind of looking at what specific variables they mentioned that they use or measures that they use, and you're like, I want to use that too, you would use these hyperlink breadcrumbs to then go back to the study page and download the data that you need. And then you might re-review the publication for those references to kind of be like, oh, okay, what tables did they make? How do they use this? So you can download the data and documentation from the study page, as I mentioned. And I already kind of talked about the two different functions, how there's the two download buttons, from the main download on the right-hand side. But this is a glimpse of the data and documentation tab. This particular study, this is that MIDAS example, it does only have one data set, but there is a preview function, and then there's the download button. But still, this would be useful if you were like, I only want to download the questionnaire just to see what questions were asked, or I only want to download the code book, so that you could maybe see the variables all in one place. MIDAS also likes to release a README file for all their studies, which I think is really helpful. And it's kind of like their memo to secondary researchers on tips for using the data. Now, you must be logged in to download data. You can download documentation for many studies, I think, without being logged in. And you can review variables without being logged in. So those demonstrations I had on the screen, you don't need to sign up for anything for it to see. But once you decide to download data, you need to make sure you have a Researcher Passport account. And you can use your email or your Google account or your organizational credentials, OrgID, or LinkedIn to create this and log in each time. And so when you decide to download data, you need to be logged into this, but then also there will be a pop-up box that asks you to agree to the terms of use. And these terms are very easy. They're not like loaded with legal, terms. It basically asks you to testify that you're not going to try to re-identify respondents. You're not going to redistribute, and that you will properly cite the data. And so that's just, that's really the only cost of using our materials is signing up for this. But we collect very little information and we never spam you. So when you do agree to the terms of use, your download will be a zipped package. And basically we zip up the materials like this for downloads to make sure that important metadata is included with your download. So say you decide, I only want the SPSS data file. When you select that, you're going to get a copy of the terms of use, and you're also going to get a copy of the code book that corresponds to that particular data file so that you have all the information you need when you actually go to use it. When you have multiple data sets, actually, and even when you just have one, the zipped package, when you unzip it, there are the files nested within folders. So it follows a data set format. So these folders are named DS0001 through whatever number of data set that they're there. So if it's only one data set, you'll just have one DS0001 folder. But in this example, there are several data sets. There are 6. There's also some documentation outside of those folders, and those pieces of documentation are related to all of the data sets. If there's a piece of documentation in a data set folder, that means it only relates to that specific data set. So say you've used our data and you are about to publish and you need to write your list of references, and you're like, oh, I need to cite that. You can grab the citation right from the study page. You can copy and paste it, or you can export it to RIS or EndNote. And then, if you send it back to us, you can submit that citation and be linked to the very data that you use, just like you saw with all the other related publications. And there's a email in these slides. If anybody wants a copy of the slides after, just let us know and we can email it to you. But basically, if you email us your citation, you'll be linked to the study, and we just ask you to refer to the study number and DOI. So another way that we organize the data that we host is something called the NACDA portal. And this is a younger project. It's been around since about 2019 for us. As I noted with our NACDA site, the default way to access data sets and documentation are study pages. But the portal is unique because it takes multiple longitudinal studies, and we organize all of the data and variables from those studies by concepts, or we call them topics. So this is our way of sort of trying to think of aging health measures and other cognitive health measures, and look at the data and let the data tell us what kind of topics are there. And then when we organize it by those topics, they are interactive links you can click on and then view the variables in like a table view to see them longitudinally instead of in a stacked view. And so, like say you're looking for activities of daily living, there's a topic called activities of daily living. And if you click on it, it would show you all of the variables related to activities of daily living and what waves they occur in within a longitudinal series. So this is a proof of concept we've been working on, and we're hoping to grow it some more. It does require a separate login from ICPSR's Researcher Passport because it's a separate project. But same as ICPSR, we collect very little information, name and email, and it's free to use. So this is an example. It's tiny. I'm sorry it's so tiny. You probably cannot see it. But if you can see anything on here, on the left-hand side, there's a list of things. That's an example of some topics such as pain, cognitive function, mental health. And then there's this table view. And within the table, we have the actual variables that occur across time for a series like the study of women's health across the nation in the United States. And then there's an actual add to basket function where you can choose which variables you are interested in and then make a custom data set or PDF code book to refer to. So it's something I encourage you all to check out because I think that when people come to our site, they can get lost in the results. You type in a search term and you can get thousands of results. And so I recommend thinking about how a question is asked and what kind of term might be in that question. For instance, something like if you're studying something like activities of daily living and a respondent is asked about how many times did it take them to stand up from sitting in a chair, you might want to think about how that question is asked and then search for terms in that type of question. But anyway, it's a lot to think about. And so the portal is our way of taking a step towards an easy button where we've thought about that for you and organized this in this way so that it's more fair, more findable, accessible, interoperable, and reusable. And so we're hoping in the future that we can have more of an easy button so that researchers can find what they need with the data.
Yeah. So speaking of the easy buttons, the NACDA portal is definitely the step towards the interoperability, harmonization. So this is a harmonization tool for people who are interested in using multiple waves or multiple data sets in order to harmonize across different data sets or waves. This is more of an internal conversation and conversations with the stakeholders, and this is what to watch for. And we also have a paper on the NACDA portals coming out pretty soon, so stay tuned. And this is on how ICPSR and NACDA are sort of changing. And so portals are mostly shifting from static repositories. So you search your variable, and then you see the data sets, and then you download the data sets. But it's moving towards more of an interactive research forms where you can discover and it will give you insights. So as opposed to searching for depressive symptoms, you can search for, hypothetically, you can search for how does social support affect depressive symptoms in older adults. Find me all the data sets that might have all of the variables that pertain to my research question. So I think it's going to move towards that direction a lot more in the coming years, in the coming 5-ish years. And so semantic search is a definitely important function for us. And we also have some of the automated metadata enrichment. Metadata is the data about data sets, right? So metadata will have your information about the sample size and the variables and the variable labels. And AI can probably help tag some of these topics and flag similar variables. So for example, the wake up and go, how long does it take for you to wake up and go? And you can search that variable, and AI will probably automatically suggest some of the variables that are related to this wake up and go variable specifically. So we're definitely moving towards that direction. So stay tuned. Like, think about what to watch for. And also when you use the NACDA portals and you have specific questions or comments about how the portal could be improved for better usability, like, please let us know. One thing we sort of want to think about is the AI, right? So we just got multiple statements from one of the largest data sets in our archive about the AI use statement. So they specifically prohibit you from using AI to analyze your data sets. So this is sharing and copying and pasting raw data sets into an LLM, right? Like ChatGPT. So that's a no, right? So don't share or paste raw data sets or raw variables into AI, raw data into AI tools, because even if it's publicly available, because that's still data redistribution and it's the copyright infringement. So we don't want to do that. And we have actually seen some instances of publicly available data sets being shared, which is not a good thing. And when you do get results on your analysis or your syntax or codes, don't treat the outputs as truth. So there's really no black box conclusions. So definitely validate against some of the documentations and do the basic checks, right? And there's a lot of context and provenance that would be important in this context, right? So AI doesn't really take into take into consideration some of the sampling strategies or weights at different waves, right? If you're analyzing longitudinal data sets, there's weights for specific waves. So the weights are not really considered. And missing patterns, there's attrition, right? People drop out from the studies. That's another context that should be taken into account that AI doesn't necessarily take into account. Some of the mode effects like survey effects, like mode of data collection and some of the waves.
Yeah, I think it's interesting because you think, oh, I can just copy and paste this into ChatGPT and no big deal, right? But basically when it comes to even the public use data, when you agree to the terms of use and you agree not to redistribute, a lot of people might not think about how copying and pasting into ChatGPT is doing that. But the key is that those kind of, publicly available AI tools, they store the information for later use, and that's what makes it count as redistribution. And so there are some like private tools that are not connected to any networks like internet or anything like that, maybe are used to help create models to then do further analysis. And we've had some people write to us and say, hey, this is our plan. And, given the right conditions, we approve that plan. But it's new territory for everyone. And so I think these are great pieces of advice.
Yeah. So in conclusion, don't automate. Or don't automate away ethics. And it also poses important challenges for us with qualitative studies, because with qualitative studies, it's way more identifiable using AI. So it's a lot easier to identify individuals or groups of people using AI. So that really poses questions for us in terms of, how do we ingest? How do we think about the qualitative data? How do we share this in a anonymized, de-identified way? Like, how much do we know? So that's that. And we have, if you scan this QR code, it will lead you to the NACDA website, and then all of the NACDA portal, and then we have a podcast. So we have a YouTube playlist, including the podcast, and in some of the seminars and workshops, you can sign up for the newsletter. And we also have some of the NIH data sharing resources because we're NIH funded, and we can connect on social media as well. Yeah. Thank you so much.
Mm-hmm.